thank Sanem. I must thank Sanem not only for inviting me to moderate this session, but more importantly, to organize this session to highlight the importance about the linkage of COVID-19 transmission mechanism with the labor market, education, and different other aspects of women. Now, today we are very delighted that we have with us two very distinguished panelists. We have Dr. Mona Shrestha Adhikari. She is the Chief Executive Officer, Enterprise for Management, Economic Reform and Gender Equality, EMARCH, Nepal. We also have Dr. Fahmida Khatun, who is the Executive Director of CPD, a leading think tank in Bangladesh. We were supposed to have Dr. Nisha Taneja, who is a professor of ICRIAR, but unfortunately at the very last moment, she had to face some family emergency, and so she was not able to join with us. But we definitely have two very distinguished panelists, and we also have Dr. Salim Raihan, Executive Director of SANEM, and he will also add some of his thoughts and ideas in this panel. Now, when we are talking about COVID-19 pandemic, first of all, we know that when we are talking about this pandemic, we have been going through this COVID-19 pandemic for the last more than 1 year. And now during this more than 1 year course of time, we have seen that it has affected not only the economies, but also our lives. And when we are talking about our human lives, then we know that when we are talking about any pandemic, any economic shock, any war, in that case, in many of the cases, the evidences suggest that women bear the burden more strongly than men. And this COVID-19, this is no exception. And when we think about and when we try to think about the transmission mechanism, how COVID-19 might have affected different genders in a different manner, and that's why this session is important. We want to highlight these things through our distinguished panelists. Then one thing we can think about a direct channel, which is more monetary channels. So we have seen that people have lost their jobs, they have to change their jobs, their earnings have been reduced. And in many of the cases, because women are often lag behind in the labor market, and they are mostly represented in the engaged in the informal labor market, we have found that in the evidences also has shown that the monetary cost for the woman is quite high. On the other hand, we also seen that if you think about the education, there has been a gender divide already in the education. If we think about mostly in the higher education, and in that case, we also see that women are the gap between men and women. That is likely to be broader when we think about at this moment. On the other hand, also there can be some transmission mechanisms which are maybe not so direct, but which are very important, and which is rather direct if we think about non-monetary perspective. So there are issues like increased gender-based violence. There are issues related to more burden of unpaid care work. And there is also the fear that there are many long-term consequences as well. When we are talking about the long-term consequences, we must know and we must realize that we are still struggling with COVID-19. So there are some long-term consequences as well. And when we are thinking about the long-term consequences, and when we want to look at this from a gender lens, then there are issues like nutritional aspect between the girl child and the boy child. There can be issues related to the increased dropout of girl child. There can be issues with increased unpaid care work. There is a fear, and very importantly, there is a fear, and there has been evidence that COVID-19 is having a very negative impact on child marriage. So if we think about all of this thing, short-term, long-term, and direct or monetary impact, or something which are not very direct and non-monetary impact. This is very important that we have this session. We discuss about the challenges that women are facing and what are the ways to deal with the challenges. But when we are talking about this, we also should realize that, and we must not forget that before COVID, in the pre-COVID arena, there were also gender divide. There has been gender divide in labor market outcome, gender divide in educational outcomes, especially in the tertiary education. And we have also seen that because our panelists are from South Asian countries, and there are a lot of participants who are from South Asian countries, we know that in the South Asian countries, due to patriarchy and due to the gender-centric norms, there are some additional constraints and additional burdens towards women's empowerment in the labor market, in education, and in other aspects as well. So we know that now we have two very distinguished panelists with us, and we want to hear from them because we know that they have been working for decades on issues related to different aspects of the economy, on trade, on regional integration, on the labor market, and both of them have been working very closely on the gender issues as well. So without further delay, I would like to invite Dr. Mona Shrestha to talk about what challenges and what are the constraints that you are observing or you want to highlight regarding the challenges that women are facing at this moment.
Dr. Bidisha, just to kind of provide an information for the panelists, probably you could mention about the initial time, kind of, so that they can frame their presentation in that way.
Okay. I think both Dr. Mona Shrestha and Dr. Fahmida, you can talk for probably 14-15 minutes, each of you, and then we can see that how much time we have left, and then we will go to Dr. Salim Raihan, and then we will again come back to you, and after that we will take question from the audience. Few housekeeping rules. Maybe you have already seen this in the conference, that if you have any questions, then you can definitely write the question in the chat box, or you can also raise hand. And after the discussion, after the 2 rounds of discussions, then I will take the question and I will ask the question to the panelists. I will pose the question to the panelists. So over to you, Dr. Mona.
Thank you, Dr. Bidisha. Good morning, good afternoon, and good evening from whichever part of the world you're joining in. I would like to congratulate and thank SANIM team, particularly Dr. Salim Raihan, for having this specific session related to gender issues, and I'm very delighted to be a part of it. As Dr. Bidisha has already explained a little bit on the context, having, as I said, this particular session just focused on gender issues itself is a great initiative. And it's very important that economic conferences in particular do so as well. The general impact of COVID-19 on women's, say, economic status, if we look at it, majority of the cases we can see is that it's the health, both mental as well as physical, and the safety concerns of oneself and those who care about, that we care about, that has been affecting us all in different ways. And if we look at the different role of women and the impact of COVID, say if we look at, say, women as workers, they have been affected in terms of receiving their salary. Their working modality is more of a working from home, which is not possible for many. Similarly, if you look at women as employers, they have been facing problems related to payment of salary, order cancellations, sourcing of raw materials, making payments for the installments of their loans, the tax, etc. Women as caregivers, we also have that role, and majority of them face time constraint and they are facing work overload. Women as homemakers, we know they are forced to manage with limited resources, including income. We also know that there are some women who are disabled women, and they face low esteem, psychologically, the feeling of being, like the non-contributing member, as a burden to the family, etc. We also need to be always mindful that women as a group, we share similar opportunities and constraints, but the extent, the articulation, and the consequences of these, they may be quite different for different groups of women with regard to, their material, educational, or ethnic background. And it's the marginalized women who are often those who are left behind due to the socioeconomic conditions, and those who are also made to be left behind because of the discriminatory, structural, and practical barriers such as patriarchy, as our moderator has mentioned. And these women include those with disabilities, indigenous women, and those in the informal sector, such as home-based workers, to name a few. I would like to touch a little bit more on the pre-COVID scenario, and then I'll come to the COVID scenario, focusing more on women entrepreneurs with whom I work with closely, and I myself am a women entrepreneur. So if we look at the pre-COVID scenario, there have been certain studies that document, we know very well that women most often are the ones who own or manage the small companies, so they're very micro in scale, but they tend to work in large ones. So as employers, they are small, but as workers, they are many in numbers. And also that women-owned and managed businesses, they are the ones who employ more women workers, and that these businesses are often at the bottom of the global value chains. They also face multiple survival challenges, such as getting into the business, surviving in the business or in the market, growing and or expanding their businesses. And these challenges, they get multiplied during disasters and pandemics, such as the ongoing COVID-19 outbreak scenario. Now, there exist these gendered barriers to trade, and women face greater barriers due to cultural and legal constraints, as well as labor market dynamics, which we all know. Recent study by the WTO in 2019 in South Asia and East Africa, and in 2020 in Latin America, with a total sample of 587 women entrepreneurs from 3 regions, demonstrates some similarities and some differences, which I would like to share here. Keeping in mind that the studies in South Asia and East Africa were pre-COVID, but the ones in Latin America were during the COVID scenario. Now, in all these regions, access to finance was one of the major challenges faced by respondents in running their businesses. It was highest in East Asia, followed by Latin America and South Asia. And there were other problems, such as in East Africa, problems related to economic and political environment in their respective countries, the national customs and tax regulations, the legal challenges that discriminate women, the lack of adequate knowledge on business, trade and market, skilled human resources, lack of infrastructure, etc. In South Asia, where many of us come from, problems such as skilled human resources, the lack of educated training for women entrepreneurs, and the economic and political environment in their respective countries were rated high. Likewise, in Latin America, respondents also rated the economic and political environment in the country and lack of infrastructure as other key challenges faced in businesses. Now, while all these challenges continue to exist during the pandemic as well, in Latin America, because the survey was conducted during the COVID pandemic, there were specific questions that we asked, and the responses of the impact of COVID-19 shows that almost 90% of the respondents faced challenges due to COVID. And the different types of challenges faced included disrupted supply chain, as well as managing workers, their safety, their health, and payments, as well as having to make payments for loans, interest, and making payments to clients. Those were of the highest challenge. However, there were about a third of the respondents in Latin America who also mentioned that they did receive some kind of support and or training during the COVID. And the different types of support that they received, many obtained training on digital transformation, on e-commerce, followed by training on innovation and creativity. Now, the scenario in South Asia and East Africa is also similar based on our or my own conversations with our contacts in the respective regions, although the similar kind of study is not what we had conducted. An example is of women entrepreneurs being trained now on e-commerce, which is an initiative of UNESCAP and the Enhanced Integrated Framework, BIF, that is supporting them to acquire these skills to go digital and sell online. And there is another the course, the second round of this course is also taking place in a few days again. So that is, I think, the general scenario in terms of women entrepreneurs and the impact of COVID on women, I would like to say. There's a specific study that we conducted in Nepal as well, just focused on the COVID and the disasters. Do we come back to this, Dr. Bidisha, or do you want me to continue?
I think it's okay. You still have time, and we can hear from you.
Okay. Being specific to the country where I come from, the COVID-19 pandemic, there was a study by the UNDP as well, where it notes that many businesses, they've seen a fall of nearly 95% in the average monthly revenue, and can sustain for only around 2 months if the lockdown continues. That's what was predicted. It was also noted in the study that the COVID-19 crisis had affected women differently than men, as we all know. 28% of men lost their jobs during the lockdown compared to 41% as per the UNDP 2020 study. I mean, it's this pandemic has been hitting almost all sectors of the Nepalese economy, particularly the MSMEs, the micro, small, and medium businesses, as we've been seeing. So to add a pilot project entitled Revitalizing Women's Business Amidst COVID-19 Pandemic, it was conceptualized and implemented by the Federation of Women Entrepreneurs Associations of Nepal, which is commonly known as FWIN, with its partner organization Emerge, where I belong, and the technical partner Trulo.com, which is a leading online e-commerce platform. And in this project, several activities were conducted, but one of the things that is of importance to highlight here is an online survey that was conducted with 363 FWIN members, all women entrepreneurs covering the 17 districts in all 7 provinces in Nepal. I would just like to give you some highlights of this, where the focus of it was on understanding the disaster preparedness. As we know, the COVID is also a form of disaster. So we wanted to understand the disaster preparedness level. And what we saw from the survey was that despite the high vulnerability to disasters, Nepal in particular due to floods and earthquake, most of the women entrepreneurs are not aware and not prepared for disaster management. And survey data shows that while it was only a few, say 37% of the women who faced such, whose businesses were affected by such disasters pre-COVID, the COVID scenario showed that majority, again 95% of them were affected by this pandemic, which indicates a gap of the understanding of disasters at large. And also the majority of the women entrepreneurs, they have very little knowledge on different kinds of disasters, as we said. And it was mostly focused just on earthquakes. Most of them, more than 75%, had not prepared any business continuity plan. They were not aware of business continuity management. So that means they were not able to manage the effects of disasters if and when it occurs. And I think this applies to all MSMEs in particular worldwide. This is the scenario in the case of Nepal. And with very limited support from family, friends, and just relying on their own initiative, some of them hired consultants, which points to the fact that development agencies and organizations, the private sector as well as government, need to put in effort so that these women entrepreneurs are able to manage, so that they develop such kind of business continuity plan, BCPs, and understand the business continuity management. We talked about the impact of the disasters, where it showed that businesses were strongly affected by a disaster like earthquake, followed by flood, landslide, and epidemics such as fire, storm, etc., and even this COVID pandemic, which was never in the list of the disasters earlier. The closure of businesses for a prolonged time, financial problems, managing salary for workers and staff, as we said earlier, the supply of raw materials, cancellation of orders, mental well-being. These were some of the alarming issues that women entrepreneurs faced due to the COVID pandemic. Now, we also know that different sectors of the economy, they are affected differently by different disasters. And here what we saw from the survey was that service sector appears to be hard hit by the COVID-19 pandemic. For agriculture, the problem was more in terms of delivery of products to the end consumers, wastage of perishable products, lack of raw materials and inputs, and cancellation of orders from comparatively the bigger challenges. Mental well-being appeared to be relatively more challenging for those in services and manufacturing sector compared to those in agriculture. And the smaller the business, the higher the impact related to the closure of business and mental well-being. So these were some of the findings of the particular survey that we did in Nepal. I'll stop here and we'll come back. Thank you.
Okay, thank you so much. Yes, Dr. Shrestha, I also agreed that you have been discussing about the challenges that CSMEs and the female entrepreneurs they face during the COVID, and they also have been facing a lot of challenges in the pre-COVID scenario as well. And the similar thing we have seen in the context of Bangladesh as well, because when we are talking about Bangladeshi entrepreneurs, like there are some facilities, but the problem is many of the facilities, the women entrepreneurs, especially those who are at the grassroots level, who are in the rural areas, sometimes they don't have information. They don't have they don't have the access to credit. They don't have the proper networking to the banking channel as well. So all of these things, and on top of this, there are also like the patriarchy and the conservative social structure. So all of these things have constrained the female entrepreneurs to get into the to get access of the credit, to set up their business and to expand their business. And when we have seen that after the COVID, because they generally have a very small capital based, they have been hardly affected by the COVID pandemic. And some of them, they have to, they try to cope up while taking loans, borrowing from the relatives. So there were different coping mechanisms, and there has been incentive packages from the government as well. But the fact remains that women entrepreneurs, and especially those who are small women entrepreneurs, their problem is they don't have a proper network with the banking system, and often they don't have the required documentation. So all of these things constrain them to get access of the incentive packages. So we have seen that although there are some incentive packages, small enterprises, medium enterprises, and obviously and mostly those owned by the women and those owned by the women who are working in the cottage industries as well, they were not able to access those incentives. So we also share this sort of similar experience. So thank you so much, Dr. Shrestha. Now we are going to hear from Dr. Fahmida Khatun. Dr. Fahmida Khatun is Executive Director of Center for Policy Dialogue, and we know that she has been working for quite a long time on different issues like micro issues and macro issues, trade, and related to other aspects of labor market, and also gender issues and issues related to other areas that is related to also the post-COVID challenges as well. So Dr. Fahmida Khatun, over to you. We would like to hear your insights.
Thank you very much, Dr. Vidisha. And I would like to also thank Sanim for organizing this important seminar. In fact, during any large important seminars, women's issues do not feature as important enough. But I'm very happy, and thank you once again for organizing this. So I think much has been discussed already. Vidisha has given a very nice landscape of the whole problem, the issues related to women during COVID period. And then Dr. Mona also has given during her discussion, she has painted quite exhaustive picture of what is happening, particularly in case of women entrepreneurs across various regions. So I don't have much to discuss, probably, but what I would say that it might be just repetition. But what I would also say that because this is so important, so we have to talk about it again and again. So now, in case of Bangladesh, let's start from pre-COVID period. That if we just give a context that where Bangladeshi women were situated before COVID. As we know that over the period, Bangladesh's labor force has in the labor force market, women had participated, and their participation had increased over time. For example, it was 24% in 2000, and which has increased to 36% in 2020. So though it is not equal as men, but it has been increasing over time. And also in terms of the structural participation, like majority of the women would be working in the agriculture sector, about 60%, and about 24% in the services sector, and 17% in industry, and also in another 15% in the manufacturing sector. So we can see that in across various sectors, women's participation is quite prominent, though in some sectors they are lagging behind. But over time, I would say that the participation has increased. So as a result of this increased participation, there has been an empowerment of women, or rather, I would say to some extent, it has improved over time. Their status in the family and also in the society has increased, particularly as we know that those who are working in the ready-made garments, a large number of them are working. So their opinion in the families are heard, and also they can express their opinion. And besides that, their nutritional status in the family, that has also increased. And as a result of their economic activities, the overall family welfare and particularly children's education has also increased. And we have seen that over time that the problems like child mortality, maternal mortality, those have been declining. Of course, there have been government initiatives, but also several non-government organizations have been working towards women's empowerment. And so I would go to discuss some of the findings of studies on women entrepreneurs. But before that, I would also like bring out some of the issues which have Vidisha touched upon in the beginning. As we know that COVID-19 has been a crisis where economic activities had dampened, and both demand and supply shocks were observed. And as a result, the women who are mostly working in the informal sector in Bangladesh, in the labor market, most of the workers are in the informal sector, about 85% in gender on average, but women are 90 about 91% of the women who are working, they are in the informal labor market. So which means that when the shock was felt at the beginning of the COVID-19, so they were the first one to lose their jobs. So they had to, those who work as day laborers or at home, somebody's home, and they are their jobs are not guaranteed, so very insecure jobs, low paid jobs. So they had to lose their jobs, and many of them had gone back to their villages. So that's why a large number of women had actually been affected more than men, I would say. And also several studies have been conducted regarding the burden of work. Women were at home, but since most of the family members, they were also without jobs, so all of them are at home, and the workload had really increased substantially. And in addition to that, violence had also increased. Several studies have been actually conducted in Bangladesh by many organizations, which reveal that violence during COVID has increased substantially on girls and women. So COVID has really, not only impacted economically, but also socially. And the other aspect is that during the COVID, for the last 1.5 years, we see that educational institutes are closed, and particularly those which are at the village level, schools. And what has happened that the children from the poor families, particularly the boys, they have been sent out for income earning activities, or they're looking out for jobs. but the children, they were married off. Parents felt that they are the burden, and it is the best time to get them married off, which implies that the child marriage will be increased. We don't have data yet, but I apprehend that in the next survey, the child marriage would be increased more further. And also, it will have an impact on the health of the girls, because they will have children at an early age. So the health of the mother and the children both will be affected. So we will not have a healthy, human resources in the, a generation may be there where the health of the children will be affected. So this is something, which is going to have a longer term impact. It is not something that, COVID is, when COVID is over and everything will be solved. No, this is going to have a medium to longer term impact. So, and women are the most vulnerable in that case. So coming back to the issue of entrepreneurship during the pandemic, we have also seen that the women entrepreneurs, particularly the cottage, micro, small, and medium enterprises, they have faced challenges. And many women in our country, they are working in the sectors like handicrafts, agriculture, jute products, then garments and accessories, retail, tailoring, beauty parlors, and all these. So these, since the economy has been, has been affected, and also for substantive amount of time in 2020, about 66 days, the economy was shut down. All the economic activities had to be stalled, and also following that, we are seeing we don't see much uptake on the demand. So there has not been demand for many products yet. So they're still suffering. And as has been mentioned by Dr. Mona Sister also, that many have had to scale down their businesses. They had to also lay off their workers. And in fact, in Bangladesh, there has been stimulus packages for various sectors. And for the CMSME sector, there were 20,000 taka for the sector. However, it has been very challenging for women entrepreneurs to access those, as Dr. Vidisha mentioned, that many of the women entrepreneurs, even the male entrepreneurs, the smaller ones, the CMSC ones, they function in an informal manner. They do not have trade license. Many of them do not have trade license, TIN number, and also they do not have collaterals for taking loans from the banks. So that has really constrained. And since the process is very complicated, many also did not want to go to banks for loans. So we had also undertaken a survey among women entrepreneurs. What we have seen that yes, many had actually had to close their businesses. However, many really struggled to survive through. They showed their resilience. And since the scale is very small, the number of workers is also small. We did not see that many had really laid off that many workers. So they tried to survive in whatever manner they did. So this is and the other challenges what Dr. Mona has mentioned are similar in case of Bangladesh too. And I would also mention the other thing, that now that we are facing all these crises during COVID, we are also thinking of COVID recovery. When we discuss about COVID recovery, then the smooth recovery cannot be possible without changing or reversing the situation of women who have been suffered seriously. I would also mention here again that we are talking about women entrepreneurs, but apart from the entrepreneurs, the other women who are poor, marginalized women, we have seen that support has been there from the government. 35 lakh households received direct cash support. However, if you look at the number of women-led household, much less than the male-led household. So here the problem is, this is a general problem, but I think the women also face a bit more challenges in terms of getting on the list of beneficiaries. So when in terms of distribution of social safety packages, uh, the correct beneficiary list is a problem. Many who do not require the support, they are on the list. Many who require, they are not on the list. So getting into the list is also quite challenging in terms of the fact that they have to be connected to the local powerful ones, and women lag obviously in terms of lobbying for their names to be on the list. So that's a challenge. That's a structural challenge. That's true for all the poor, but I think more true for the women who are poor. So that's another challenge which has also made them more vulnerable, that not getting the direct cash support. So now coming back to the issue which I was discussing, that I would close now, that in terms of recovery, we are now when talking about that what kind of recovery the economy would be having. And many have been discussing that the recovery would be K-shaped, meaning that some will be recovering faster than the others will be lagging behind. And women would be one of those sectors, or one of those people who would be recovering from the shock much later than the others. Therefore, when you talk about smooth and sustainable recovery, special attention, special measures have to be actually taken for women. Here I will just recommend one or two suggestions. One is that bringing women into the labor market. Once this is across the board, in fact, those who are educated, less educated also, that during the post-COVID situation, the world of work will be different. As we are mentioning, as we are observing, that the nature of work has changed. We have changed our mode of work. We can do a lot of work by using technology, and this will be adopted more and more during the post-COVID period, which implies that those who do not have skills and those who do not have access to technology, they will be lagging behind. And I'm afraid that women would be in that group. So that's why the skills development, capacity development would be crucial for women in order to bring them back to the labor market. And also for the women entrepreneurs, when we are discussing, the loans are there, but more than loans, they wanted some relief in the sense, the grant in terms of, like, many of them could not pay their rental rents and also the utility bills. So they wanted, and those who have loans from the bank, they wanted to wanted their interest to be waived. So those types of support would be more useful for the really smaller businesses, and particularly small business, women businesses. I think I would stop here. I think we can discuss later on. There are so many issues to be discussed. Thank you very much for your patient hearing.
Many thanks, Famida Appa. I think we have heard quite a lot of issues especially related to the demand crisis that you have highlighted, and how that have affected the labor market, and that can have important implication for the labor market participation of women. Now we have with us Dr. Salim Raihan, Executive Director of SANEM and Professor Economics Department, Dhaka University. So we would like to hear from you.
Thank you, Dr. Bidisha. Of course, we are missing Dr. Nisha Taneza, because she was supposed to here with us and also share her experience, especially the Indian experience with this panel. I think it would have been great if we could hear from her. But due to some family medical urgency, she is not able to make it. So I'm not here to just to fill her gaps, but I think to have some gender balance too, because we are talking about gender issues, and just to also show that and to share our feelings that gender issue is not only being discussed by the females. We male also share the same kind of feelings, and we are here. And Sanem is very much committed. I know that Famida from CPD and Mona, they are very much committed. So we also want to share that feeling. I thought that just to highlight few points, I think so far, very excellent discussion from three of you, Dr. Bidisha, Dr. Mona, and Dr. Famida Khatun. And also few issues actually came up. For example, one important aspect is that the COVID, it has important gender implication, both of which in terms of its impact, how it's impacting, and also in the recovery process. So we need to have very good understanding of this gender implication. But I'm really afraid whether our policymakers, not in Bangladesh but also in South Asian countries, they're very much aware of it when it comes to the gender implication of the impact on the recovery process. The reason I'm saying why the policymakers are not really being that much of concerned is that the kind of available information, the lack of available information, especially from the official source. Because we have not seen much effort from the government, it's not only I'm talking about Bangladesh, but other South Asian countries also, to conduct surveys during this pandemic, also generate information. So we actually, the civil society think tanks, we actually came up as a kind of rescue. SANEM did surveys, a lot of surveys, and I know CPD also did, and some other think tanks in other South Asian countries, they also did. And so we are coming up with some evidences to help in the policymaking process, especially with respect to the point that I made that COVID-19 has important gender implications, both at the impact level as well as the recovery level. Now, so I think SANEM survey, two surveys actually. One was in November, December last year, and another one in January, February this year, actually very comprehensive kind of large-scale household survey. We found that there are important gender impact that's happening at the household level, at the farm level. So at the household level, there's the intra-household distribution challenge. And even in the past studies, it has shown that whenever there is a shock in the household, it is the female and the child that bear the major burden. And the shock is not evenly distributed among the family members. And shock like COVID is actually having the similar kind of uneven distribution of the shock within the household member. Also, we have seen at the farm level, women entrepreneurs, and they are not actually, as Dr. Famida Khatun, she was very nicely elaborating that they are not actually on the same level of footing, especially they are having many challenges. Many of them are at the micro, small, and medium enterprises. They are facing a lot of challenges. In the labor market as well, we know that the female labor market participation in South Asia also some definitional issues. Dr. Mona can talk about that. But if we take Nepal out, but other South Asian countries, especially India, the largest country in South Asia, the female labor market participation is very low. And there is a big concern that COVID can actually affect that labor market participation further, females. So, the female who were actually participating in the labor market in countries like Bangladesh, India, Pakistan, Sri Lanka, and other countries, whether COVID will have some negative implication for that. So I think, now when you talk about these gender issues and when you talk about this COVID impact, in my opinion, there should be 4 major areas we should look at. Whether it is pre-COVID analysis or post-COVID analysis, or even during COVID analysis. I think these 4 perspectives should be there, when you talk about the gender issues. Especially, I think, setting the parameters. I'll come to those 4 points, but before that, what are the parameters when you talk about the gender issues? We know that the SDG 5 is very much there, and actually that can help us in setting the parameters. So let's talk about broader women empowerment, women's economic participation, and women economic empowerment, labor market participation, and women entrepreneurship, many other things, gender-based violence, and many other things. But I think we need to actually look at these issues very carefully. For example, when you talk about the labor market participation, enhancing the labor market participation of the female, we know that it has several shortfalls. For example, one paper by me and Dr. Vidisha and one of our co-researchers, we looked at the unpaid family labor. Even you have this labor market participation of female, increased labor market participation of female in Bangladesh, but we found that a large part of it is actually unpaid family labor. And by definition, they are included in the labor market participation. So what is actually happening during COVID? This unpaid family labor. And then, so if you look at the simple broad labor market participation of female, I think there could be some, underestimation, or so I would say overestimation of females' actual labor market participation. Now coming to that 4 areas, where, as I said, when you talk about the gender issues, first is that the historical context and the structural context under which all these gender issues we are discussing, and some of these structural context can't be changed overnight. It can be cultural norms, it can be religious factors, it can be many other factors. And it's something amazing, like, even being a very Muslim religious region dominated is much higher compared to India. And also we have seen that women participation through NGOs, and one of the largest sector is ready-made garments. So how all these things being, COVID is affecting, whether COVID is having a different narrative on this historical context or structural context. I think this is something very important when you discuss about this. My second point, I think, which is very, very important, is about the economic policies. So in the South Asian countries, we have seen that pre-COVID scenarios, time, the economic policies were not really very favorable for enhancing women participation in the labor market, also in the promoting women entrepreneurship. And there are many other areas too. It's at varying degree, of course. For example, in Bangladesh, women's participation in ready-made garments was definitely a favorable economic policy. But in other countries, probably you don't see that kind of thing. Also, even despite that you have this favorable economic policy by, for example, promoting ready-made garments, we also have seen that in terms of minimum wage and other labor conditions, there are serious issues. So whether in the COVID scenario, in the recovery process, are we actually having the right kind of economic policies which can actually address the gender issues? I think and Dr. Fahmid and Dr. Vidisha talked about the stimulus package. I think they fall into this category of the economic policies, whether we have the right kind of policies. My third point of area is the social policy. And very rightly, Dr. Fahmid Khatib talked about the education challenges, the lost, in terms of lost academic year, and also the early marriage, the risk of early marriage. And our surveys also came up with these kind of findings. Health, education, and social protection in all these areas. Actually, whether the COVID scenario and the post-COVID, the kind of roadmap, I'm not quite sure that the countries actually have a roadmap. We are seriously lagging, I think, having a roadmap of recovery, not only in terms of economic recovery, but also in terms of social recovery. I think we need to speak up and we need to come up with solid evidence, on these social policies, whether the countries are actually having a right kind of social policies. My final point is about, I think that's what we don't really talk much about, but I think these are the kind of institutional context, the kind of political economic context. We have seen that during the pre-COVID scenario, there is a bias against, it's a kind of, structural bias against female, and also in terms of female labor market participation, in terms of promoting female entrepreneurship. And also, despite the way it's funny that probably you would see that very nicely written policies on the paper in terms of promoting female entrepreneurship or enhancing female labor market participation. For example, if I mention my country's plan documents, starting from 6 5-year plan to 8 5-year plan, or even the perspective plan, all nice words are there, in terms of promoting gender equality and other things, but they are not being implemented. Lack of state capacity, capabilities, and other institutional challenges, these are not being implemented. So are we witnessing some different scenarios in the in the COVID context or in the recovery process? So I think those things need to be discussed and put them into the kind of framework. My 4 points: historical context or structural context, economic policies, social policies, the institutional context, I think when you talk about the recovery process, and it has to be a gender sensitive recovery process, these 4 areas need to be addressed. And when I talked, I think I tried to pose some questions to the panelists. I hope they will also try to respond to these questions in the second round. Thank you, and over to you, Dr. Vidisha.
Thank you so much, Dr. Raihan. I think it was very important to have a gender perspective as well and to have. While we were listening to you, there has been a very active chat box, and I can see that there are several hand-raising options as well. So that means that there are a lot of questions, the discussion that our distinguished panelists that they have provided, that has generated quite a lot of questions as well. And I think people are eager to hear from both of you. So in that case, I'm just wondering, maybe we can just start taking the questions, and after we take the questions and the panelists respond, then we will just come back to you, and you can just conclude or add anything that you would like to include. So there are questions, and I think if we try to see, there are some questions which are related to, I can take a few of the questions, and then maybe 2-3 questions, and then I can go to the panelists, and then I will take a few other questions. So there are some.
Just to help you, there are questions in the chat box, and also there are people who raised hand.
Raise hand, yes.
You can actually, take 1 or 2 questions from the chat box and let people who raised hand to speak up, so that have a balance between this chat box and the raised hand. Yes.
Okay. In the chat box, there is a question raised by Afia Mubashira to Dr. Fahmida. In fact, she's asking that how can we aware parents against early child marriage of girls during the COVID-19 situation? What would be your suggestion to the policymakers in this case? Because in that case, like, won't we lose a lot of potential women entrepreneurs? I think it's not only potential women entrepreneurs, maybe potential women leaders and potential women researchers that will be lost if we do not stop this child marriage and the issue of child marriage during COVID. So this is a question specifically made to Dr. Fahmida Khatun. And there are some other questions. Ishrat Sharmin, she also asked another question to Dr. Fahmida. The question is like, why has there been stagnated female labor force participation in Bangladesh even before COVID, and how the pandemic might affect the phenomenon? And Dr. Bushra have asked a question. I think Dr. Mona might be interested to answer this question. So the question is related to, in the case of Pakistan, we have seen that sticky floors are more acute than glass ceiling. What can be done to resolve this issue? Because I know, Dr. Mona, you are a CEO at Emerge, so you are in a leading position. So you might be dealing with the issue of the glass ceiling. So you can answer this question as well. So there are some people who have raised hand. So if I just start from Jahidul Qayyum. So those of you who want to ask question, kindly try to ask question within 1 minute, and unmute your microphone and ask question. Jahidul Qayyum.
Okay, I won't take much time because I have listened to some of the issues I raised in my chat box, and Professor Salim Jahan has rightly pointed out those issues. Just one point, it's not basically a comment, not really a question, but we know the situation is already, disparities are there, but some of the issues, I think, the situation that the women have suffered during COVID, which of course is that is common for everybody, and that has worsened, and probably they have suffered more. Probably we haven't done much studies on that, but there has been some studies that has really indicated that. The issue that I want to kind of really bring that issue mention here is And if we are talking about the entrepreneurs and women working in the labor forces and the participation, and then the trend is again going a bit backward, that women's participation was much more higher compared to many other South Asian countries. My point, I want to kind of emphasize that what has been changing and what has made the COVID worse the things are getting worse. So I think we should emphasize on those areas. But my point is, again, we should kind of try to keep what we have gained pre-COVID situation. We don't go back to that what we gained. So that are the issues we don't need to address. So it's basically a general comment, not very important question also. Over to you. Thank you very much for giving me time.
Thank you. We have Sayeda Tasneem. Do you want to raise your point or any question that you might have?
Thank you, ma'am. My question was that the Global Gender Gap report shows that Bangladesh is one of the top countries, actually the top ranked country in South Asia in terms of narrowing the gender gap. So do you think that such indicators, which are often based on large scale macroeconomic data, paint a false picture of optimism for gender inequality in countries like Bangladesh, where we know that the government's capacity for handling gender issues, at least in the micro level, is actually quite poor? And should these indicators be taken with a grain of salt? Thank you.
Interesting question. Okay, shall I go to the panelists now? And maybe we can come back again to the chat box and to the participants. So maybe I can start with Famida Appa, and then Dr. Mona can.
Okay, thank you very much, those who have posed questions. Very interesting and very important question. The child marriage, how can be parents aware of? In fact, I think this is the child marriage is not an issue of the family only. Of course, it's the decision of the parents, mostly parents. I mean, not the children in our country mostly, but it's not only the decision of the parents, but the circumstances, the socioeconomic conditions, the policies which are in place, they influence a lot in terms of deciding the marriage of children. Or when I was discussing that the parents do not see the girls as their, as a member who can earn their livelihoods, and also rather they feel that they are the burdens, and it's an extra burden for them to maintain and to bear their expenses. So this is one. So this is purely from economic point of view. This is what is happening. And secondly, also, of course, social aspects are there, that there is still lack of thoughts or lack of understanding that the girls can be equally economically and socially important members of families. That's there, that the whole issue, that the social and cultural barriers are there, which forbid them also that from the thought that girls can be educated and then they can go to the labor market and they can get married later on when they are they are independent enough. So I feel, of course, this is a parents' decision, but it is not. These decisions are also influenced by the socioeconomic policies of the country itself. So, of course, and in line with that, or in addition to that a lot of awareness building is required. The organizations, micro-organizations, community level organizations, non-government organizations which are working in the rural areas, in the remote areas of Bangladesh, they also are working to increase the awareness of the parents or of the society. So that's also there. Parallelly, we have to also provide them with the tools of tools such as for education. As such, we see that up to grade 5 in Bangladesh, or 5 or 6, 7. So there is gender parity. The number of girl children and the boy children, they are at the same. But as they go up, the dropouts for the girl children, it starts increasing. So this is also this whole concept, social concept that works a lot. But again, the issue of like insecurity is another important barrier for the parents also, that now if there is lack of security for the girls to go to school or go for them. So I would say this is a combination of economic, social, cultural construct which have been influencing in case of in case of taking the decision on girls' marriage. And the other issue, yes, you are right, that the stagnation of labor market, that's the labor market participation by women. This is again, yes, one of the important factors, I would say that in case of labor market, one important impetus that had come from the 80s, from the mid 80s and all, so that is so the ready-made garments, so among the workers, 80% would be female workers. But over time, what we are seeing that the participation of female workers in the ready-made garments, that is declining. From 80%, it has come down to about 60%. One of the factors is that this industry itself is becoming more automated. Technology is taking over many jobs, and or technology is being adopted. And what is happening, because women, they lack skills, they are not the ones who can get those jobs, who can stay. So many have to leave the sector. So this is one. And of course, the other factors we are seeing that who are working. In terms of education, higher education, or as I just mentioned regarding the dropout of girl children, factor which is also a determining factor in terms of taking part in the labor market, that's there. And also in the agriculture sector, a lot of women are employed, but then they are also there. There's excess labor, what we call that underemployment is there. So that's why I would again say that this is also a combination of the economic and social factors which work against women's participation in the labor force market. Of course, this we can discuss the policies later on, but I would, to my mind, these are the major factors behind this. So I think there was another comment, very right comment, the mental health. In fact, in our South Asian context, in fact, we tend to ignore the mental health aspect. But I think COVID has been an eye-opener for us, that how it can really affect, particularly I would say that young population who are out of educational institutes for the last 1.5 years, and many of the youth who were just ready to enter the labor market, suddenly they have really they had to stay back, and they're still waiting to enter the market. So they are now out of all the networks, professional networks. So all these factors, and of course the women's situation within the household, their violence against them. So all these have really impacted the mental health, but I'm afraid we don't really take notice of that because we struggle too much to solve our economic problems. Thank you.
Thank you, Appa. We will again come back to you. So, Dr. Shrestha, I think there has been few questions for you. I think there is also another question which is by Ms. Daksha Singh. Do you like to pose this question by raising hand?
Yeah, sure.
Sure.
This is to all of the experts, like whoever can answer. So there has been a lot of support for universal basic women for women. Like nowadays, a lot of influential institutions are talking about providing a universal basic women to universal basic income to women as a way to subsidize for their unpaid care work that they perform at home. So in a way, empowering them economically. So now that considering the uneven impact of pandemic on women, that women economic status has been affected more than men. So is this the right time to introduce such kind of policies, and do you think it will be effective in South Asia? And also, is that the right policy to adapt, since considering the limited fiscal capacities of all the South Asian countries? So I think this anyone can answer. Thanks.
Thank you so much. I think now we will go to Dr. Shrestha. So if you would like to take a few of the questions and respond to those.
Okay, thank you. Thank you, Dr. Vidisha. This has actually been a very interesting session that is trying to encapsulate a whole lot of issues of the world, but unfortunately we cannot. And with gender issues being so broad and so complex, I don't think it's possible for us to tackle, all of these issues. However, some of the issues that have come up here, particularly related to economics or business and the economy, is I think something that we can still continue in this session. Related to that, it was a question from Dr. Yasmin in Pakistan, where she talked about the sticky floors and the glass ceiling. What I must admit here is I don't think this is a case just for South Asia alone. This is a problem that is global and that needs a global solution. And for this, it's not just about hitting the glass ceiling and getting more women in leadership. It's about the gendered lens that you have in an organization. How is it that you consider women workers? What are the policies that you put in place to ensure that they are not being discriminated? The whole issue about inclusiveness and diversity is the in thing now. So there are some companies that do it whether they like it or not. There are some institutions that do it whether they like it or not. And at times I keep saying this is thanks to these SDG goals and the global policies and conventions that make it compulsion in a way, whether it is through a carrot and stick rule or whether it is through naming and shaming, that there is a change in the way that institutions and organizations look at women. However, having said that, as Dr. Salim also said, many of these things are beautifully written in plan documents, and translation of those policies into reality is another step. However, having those again in policies is a fallback position. As we talk about in women's empowerment, we always need a fallback position. And I think that serves that purpose. Now, translating those policies into action, I think requires another cohort of organizations who need to lobby with the government and work with the governments, in particular on the ground, to ensure that those policies are translated into action. And if we talk about women businesses and women entrepreneurs in particular, I see a great role of the private sector to be working with the government and development partners to ensure that an inclusive and a holistic, comprehensive packages are being delivered, that there is an ecosystem that promotes entrepreneurship, that promotes inclusiveness in entrepreneurship. And for that, there is a lot that can be done. Access to information is a key thing that runs across in all regions, as we have seen in the WTO survey. So access to information is one, but having that access to information is not enough. You need to be able to know how to make use of that. For example, going online and being able to see those products or sell those products is one, but coming in terms on learning about e-payment solutions, etc., is another part. So again, it's, as I said, it's very complex, but it can be broken down into pieces, and there can be a whole range of stakeholders in which the entrepreneurial ecosystem can be much more fostering. And the question that Diksha had raised about this providing the basic income, I think there's also the other discussion that is going on is, I mean, the world economy survives or relies heavily on the unpaid care work, right? Largely of women. There are also some few men who get into the unpaid care work, which cannot be neglected. So with largely young girls and women taking the burden of the care work, that's how the whole economy runs. But it is not being recognized as yet. Recognition could be in different forms. So what I personally feel is having certain schemes. For example, if you're a woman, if you're a housemaker, you do not have a paid work, when you go to a hospital, for example, there could be certain subsidies that is provided to you. When you go on the transportation, there could be a subsidized card for you. So there could be different ways rather than giving money in the hands, because we have seen of how through development aid, when money goes into the hands of women, it need not necessarily be spent by women, right? So that's another topic of discussion. And I personally am not in favor of the direct transfer of money, but I'm always in favor and advocate for policies and schemes where women do get the benefit, but need not be in the form of direct cash. So I'll stop here for now. Thank you.
Thank you so much, Dr. Shrestha. I would just like to...
Sorry.
Sure.
There was, I think someone asked a question regarding the gender gap or something. I forgot to, I wanted to respond.
I think also there is someone who wanted to ask question directly to you. She's a journalist, Ms. Shobha. So maybe you can take both of these questions. Ms. Shobha, do you want to like to ask your question to Fahmida ma'am? You can just use your microphone, unmute your microphone and ask the question. So the question was related to how many women have lost their job in Bangladesh. So I think it would be better if you explain the question by yourself, or maybe we will get back to her later. So Dr. Fahmida, you wanted to add something?
Yeah, the last one. Yeah, how many women have lost the job? So we don't have any data, but I think Salim or Bidisha Sanim had done a survey. Probably, I don't know whether that captured. I don't remember that. So it's very difficult to tell. You know, in the absence of a household survey as yet, there are. I think there are some surveys which specifically women's participation. I don't know, that I'm not aware of that, so I can't give you any number. The other question, you know, someone asked really a provocative question that regarding the global gender gap index, so which is done by World Economic Forum. You see, if you look at the indicators which are taken into consideration, so that is also there. There are 4 indicators. One is on economic participation and opportunity. The other one is on educational attainment, then the health and survival, and the other one is political empowerment. So now, if you average that, so that is the result. So in case of Bangladesh, I guess political empowerment gets the most, highest weightage. So that makes Bangladesh better off compared to many other countries. So these numbers are good. These numbers are indicative of the situation, but I think these numbers, I mean, we don't have to like take it as the ultimate, ultimate picture of the reality. But I would say I also don't want to discard these numbers. These actually provides you the magnitude of the situation. So, but since the indicators are there, so we only have a selective number of indicators. So that's why the situation is sometimes maybe not close to the reality. So that's what I wanted to add on this question.
Okay, thank you so much, Fahmida. In relation to the previous discussion, I think 2 very important discussion questions that lead to very important discussion. One is related to the child marriage and another related to the discussion regarding the unpaid care work. And I would like to echo what the panelists have said. And when we are talking about unpaid care work, we did some work at SANIM, and Dr. Fahmida also did some work. And I think we have all, we all would agree that there are like several issues, like recognizing the unpaid care work, then reducing the unpaid care work, maybe through government policies or having daycare centers and providing better infrastructure, then redistributing it. And that is very important, so that everyone takes the burden of the unpaid care work. And that needs something changing of the mindset. That is extremely crucial, and that is also very relevant when we talk about some other issues which is related to gender. Unpaid care work is important, but it is not that much of discuss. It has been, we have started to talk about in South Asian countries, I think for the last 5-7 years. Before that, we were not even aware of the a tremendous amount of the burden or the economic, if we want to include it in the economy, what would be the magnitude. And it is important because in the research and also in the empirical context, we have seen that what might be the cost of unpaid care work, because that often works as a barrier for the woman to participate in the mainstream labor market. So in that case, it often can lead to the question related to the glass ceiling. That may be one reason, like why we don't see women in the position, like in the position of a CEO of Emerge or CEO of a CPD, or in the leading position of the policy making field, because that one reason might be, and that is we also have seen with the data and with the empirical research, that unpaid care burden, that is one reason that is restraining women and the gender sensitive from to participate in the mainstream labor market. And that's why, like, recognizing, reducing, and redistributing this unpaid care work, and to make people understand that unpaid care work is related to it's something that should be related to the responsibility of the family, and often it is the responsibility of the state as well when we're talking about the child care. And in the Western countries, unlike the Western countries, in the South Asian countries, we don't see that much of the government support for the child care benefit, daycare support. So there can be incentives provided by the government to the private sector to encourage to have more gender sensitive policies and policies related to providing more child care support, and that could help women to increase women's participation in the labor market. And when we are talking about the changing mindset, that is one thing related to the discussion can be related to the issue of the child marriage as well, because when we are talking about the child marriage, I completely agree with Dr. Fahmida, and I would like to echo that there can be in fact several issues. Like when we're talking about COVID, like we have seen that with increased poverty, many of the families that have taken the measure, like to avoid the incidents of poverty, or to safeguard themselves, to reduce one of the mouth to feed for, to get their girls married. So that is something. So more poverty alleviation schemes, the schemes related to poverty alleviation, social safety net, that could be one issue, one way of tackling it. But that is something when we are talking about the post-COVID issue. But when we are thinking about the pre-COVID issue, there is one thing that Dr. Fahmida has highlighted related to the issues, more of the awareness issues. So the awareness issues, and there can be campaigns from the media, there can be campaigns related from the government, from the NGOs, that should be highlighted. And thirdly, I think another important issue should be having proper laws and implementation of the law. And that is very important. And in order to implement that, there should be increase in the capacity building as well, so that if there is the unpaid care work issue or the child marriage issues, when there is any sort of disruption, then there are laws in order to tackle the issue. So I think with that, I can see that there are one or two hands. So there is Tabina Zaviera. So do you like to ask any question, Miss Tabina?
Yes, my question is regarding the long-term impacts of current social issues such as child marriage rising from the pandemic. While there have been initiatives such as stimulus packages to help economic recovery, there have not been any major steps taken by policymakers to help social recovery. How would this impact Bangladesh in the long run, especially in the context of sustainable development goals? Thank you.
Okay. So is there any other question, or anyone want to ask question directly to the panelist?
I think there are questions in the chat box,
Okay.
Ishrat Sharmin and then Tomik Sneha. So you can read out those questions, please, or yeah, I think that's
Mir
fine.
Ashrafun Nahar, she raised hand.
Yeah,
So do you want to ask the question?
Yes, ma'am. Thank you, ma'am. I have a small question to Dr. Fahmida Khatun, ma'am. In April 2020, the government of Bangladesh introduced a stimulus package equivalent roughly $2.4 million to boost the SME and cottage industry sector. But the scheme has attracted few takers, especially women, because they were facing challenges about the repayment terms and the documents recovered. What do you think? What could be done to reduce those problems? Thank you, ma'am.
Shall I answer now? Or later I shall take some more.
One other question by Tomik Sneha. We have seen a lot of informal businesses that is done by women. Yes, many women entrepreneurs arises during economy. I mean, do they anyhow balance something in economy? I think we will obviously agree that when we are talking about the challenges of COVID, we have also seen some opportunities as well. Especially, I will say that in the e-commerce section, we have seen that new entrepreneurs, they are coming up, and many of the entrepreneurs are females. And that is something I think that can be one area that the government can also focus as well. So e-commerce and providing support to the e-commerce and to help the female entrepreneurs with the small scale credit or some small scale financial incentives, that would be something that can bring quite a major change in the labor market, because often these e-commerce schemes, those are handled from home, and when we are talking about the unpaid care work or related to the issues related to the child marriage, so the girl is not cannot work. So these things can be linked to this issue as a solution as well. So there's also one question asked by Ishrat Sharmin. According to SANIM employment survey conducted during 2000, okay, yeah, this is something she wanted to add this question due to the job loss. So in SANIM, in January, February, we did a survey, and in this survey, one interesting thing that we have found that although the participants or female participants were not very large, but still what we have seen that when the job loss scenario for the men, it was like 7%, but for the females, it was like 16%. So it was much higher for women. And I would also like to highlight that tomorrow we have a presentation on the based on the same survey. And we have also seen the economic vulnerability scenario of female that was that we have found much higher for females than for the males. So that is something that some of the evidence are there, but of course we always talk about that we would like to see proper labor force survey that would be able to fill in the gaps that we have in the knowledge. So I think now, Famida Appa, you can add the question. And I'm just wondering, like, maybe now we are almost at the end of the session. So if anyone does not, no one have any question, then I would say that if the two panelists then take some of the questions that already been raised and answer those questions, and if they have any concluding remarks, then they can add the concluding remarks. And Dr. Salim Rahan, if you want to add or respond to any of the question or fill in the gaps, then you are most welcome. So Famida Appa, over to you now.
Thank you, Vidisha. I think the question we have discussed at length, I think, on the child marriage issue. Definitely, we have been discussing that because of this COVID-19, many of the achievements which we have achieved before COVID, those are going to be reversed. They're apprehended to be reversed. And women's progress or women's advancement, that is one area where we might see some, backwards. So this is a worrying scenario, obviously, and we have discussed also some of the policy measures regarding the stimulus package. The question, yes, the issue of informality within the women entrepreneurs, that hinders their access to finance, and we are seeing that despite government's announcement for the support, we don't see that many women benefiting from that. One of the suggestions we have discussed is that getting these stimulus packages through the MFIs, the microfinance institutes, which has more network across the country, and also they have more an interaction with the smaller businesses throughout the country. They can be one way to channel the loans, actually, because those have less formalities required. On the other hand, they also have less default, so it's not that giving through them will jeopardize. That's not the so that had worked for many years, and now it is a tested channel, so it can be used at this time. I would so just to conclude, to make my concluding remarks, I would point out 2 or 3 specific recommendations regarding the entrepreneurship or women's participation in the labor market and those who want to do businesses on their own. We have seen that during this COVID-19, since women entrepreneurs have been affected, so some specific introduction of some insurance so that they can be insured for absorbing the losses that they have faced during this disaster. And also the connecting the women's CMSMEs with e-commerce and marketing agencies, so that those who produce their products, they can continue to sell their products even in a situation which is difficult times during COVID-19, and a facilitation platform by with the support of business association. There are many women's chamber. There is this SME foundation, and also women's and child affairs ministry. So they all together can form a facilitation platform through which support to the CMSMEs can be provided. Support not only in terms of direct financial support, but also in terms of providing knowledge and advice, guiding them, and also the capacity development of these CMSMEs, so that they can take advantage of the e-commerce and this digitization, so which is booming. In some other cases, we have seen that this is one business which have done very well, but unfortunately probably women have not been able to take advantage of the situation. So capacity development for them, so that they can, take advantage of that. The other important issue is that the formalization of the informal sector. Why introducing necessary policies and laws? Of course, there are many laws and policies, we have discussed that, but those are not utilized. And also, I would say that very important is that to develop a comprehensive database, national database of both women entrepreneurs and also women informal sector workers. We don't know how many are there. And how, if we don't have data, so how can we take policies? So we need a database for both women entrepreneurs and informal sector workers. And also a dedicated women counseling mechanism so that they can be provided support, and particularly those who are mentally distressed. We talked about mental distress during COVID-19 situation, but we don't do about it. So maybe a counseling mechanism through these, chambers, women's associations, and also through the non-government organizations, private sector may come up also, so that we can provide them mental support to also recover mentally from this shock. So these are the some specific points that I wanted to highlight. Thank you.
Thank you so much, Dr. Fahmida. I would like to ask Dr. Salim Raihan if you want to add few words.
Yes, actually, I'd like to take the opportunity to ask a couple of questions to Dr. Mona Srestha. The reason I'm saying, because Mona, I remember that we are part of a network on gender in South Asia, and we had some meetings in Delhi and other cities too. I don't know when the next time we'll be able to visit Kathmandu or Delhi, but those memories are really great. My question to you, that sitting in Geneva, also getting the experiences, hearing the experience of Nepal and other South Asian countries, what is your take? What is given the current scenario, and also whether do you hear from other developing countries too, in terms of the gender response during the COVID situation? That's one thing. And second thing, I would like to also propose something. Fahmida is here too, Dr. Bidisha is here too, that whether during this COVID situation, I think that the gender network need to be strengthened. So can we have a COVID response or COVID-19 gender network? Because we are facing a very different set of challenges. The very conventional way of thinking process what we had in the pre-COVID is not really going to help much, because as Fahmida and most all the panelists, they're saying that many of the achievements the South Asian countries, probably these are going to be lost. And we need to devise some new strategies, new thinking process, and to put some pressure on the policymakers and all other stakeholders too. So what would you think, in terms of, first is that, your experience of, hearing from other countries and especially from South Asia, and also in the gender network, whether you can have a COVID response gender network. Probably Fahmida, later on, you can also respond to that point too. So Mona, over to you, please.
Thank you. Again, interesting discussion so far. I mean, it doesn't feel that it's already been 90 minutes past that we are here sitting continuously in one position. We have been taught during this COVID pandemic that we need to de-stress ourselves. So I think maybe we should have some de-stress moments in between as well in these sessions. But humor apart, one of the things that I would like to highlight, and I'll come to Salim's question next, is from what Dr. Fahmida has said, I completely agree with all the recommendations she has added. I would in fact like to further add on the part where there's the need for, in fact, further joint initiatives and partnerships from the government and private sector and other stakeholders to work on the gender issues comprehensively, because just one actor cannot do these activities. Decentralization is one that the government can do, but again, you need different actors at the different structures of the government, and the private sector plays a very, very important role. But many governments do not see them as key players. They see them as as the competitors, and I think that attitude needs to also change. The other important thing that was highlighted is in terms of data. And I think that's very important to take note of data, because what gets measured gets counted. And if we can't measure that, we can't be able to count and see the implications of that. Women in formal and informal sectors both are very important players. And there was a question there in the chat box on the informal producers. Yes, due to COVID and due to economic need, there has been a lot of new home-based workers or home-based producers in the course of the COVID-19. In a way that has been good, because I've come across many in Afghanistan and in Sri Lanka and Nepal and other countries, and even some in Latin America, where they said that they were not doing any of these kind of income-generating activities earlier. But now, because of the COVID, and the husband who's the main earner, or the father, the male who's the main breadwinner, has lost their jobs, it is now again the burden of the other females in the family to start earning an income. So whichever way you look at it, I mean, I think it comes back to the role of women, again, playing an active role in the economy. And for the informal workers, I don't at one point see that everybody has to be formal, because when you get formal, there are other consequences. You have to pay tax, there are documentations, etc. But I think that's also one of the reasons why, particularly in South Asia and in many African countries, the microfinance institutions or the cooperatives have been functioning so well, because they work in the community movement. And I think that is another aspect that needs to be looked into. On the question of Salim is, yes, I mean, I have been the one who was part of the studies that we did from the WTO in all these 3 regions, and hearing and discussing with all of these 587 responses and numerous women entrepreneurs in all the 3 continents show very similar problems that they face: access to finance, e-commerce skills that is required. So capacity building is very much required. They want the government to be a key player. They want aid. But what is most important, what we saw from the WTO perspective, was that before COVID also, women did not know the rules of the trade, right? So they were producing, but they were basically producing for the national economy. And they were very much in small, as Famida had also said, in very much in garments or very much in the handicraft sector. But what we saw is that in the post during the COVID pandemic also, the problems didn't go away. In fact, they have exacerbated in different forms. And so what is important is that those of us who work on trade issues, including institutions like the WTO, need to make sure that trade rules are simplified and that kind of information the women have access to. And again, because unless and until they go regional or they go international, they are still going to be small. So where is that dream or that aspiration to upscale? And so I think that's one point to note. And the other problem that many of them faced and are continuing to face is this issue about the mental health. And that's why when this survey that was a part of the project funded by the USAID in Nepal, which is called the Tayar Nepal project, was we asked them to say, okay, if you want to support women to go onto e-commerce platforms, which we did. So we had 17 women entrepreneurs whom we provided the skills. Their products was online. And in that COVID lockdown period, we could sell their products. So that was a new achievement. But besides that, doing surveys and training was one. But we never looked at the mental health issues. And we know that unless a person's capability is being taken care of, you cannot expect efficiency and effectiveness, right, in the economy. And therefore, that mental health issue is very important, and it needs to be in a comprehensive package that development aid provides to women entrepreneurs or to women whenever you talk about empowerment of women and girls, and it would be at different levels. So as I said, we talk about building resilience, conflict resolution, stress management. All of these things have to be there so that the person is recognized in themselves, values is being valued for by themselves as well as by the others, and therefore the efficiency and productivity increases. On the next question that Salim raised in terms of having a network, I think it's a very valid and good initiative and a thought that we could all discuss and see how we can all also contribute and be key actors in this global advocacy. So thank you.
Thank you so much, Dr. Shrestha. So Dr. Famida, do you want to add anything? Or Dr. Salim?
Not really, but the last question the Salim asked, just one liner is that, of course, I also feel that we should form a network, and we should work together towards women's empowerment, and also how women can recover from this disaster of COVID-19. Definitely, I'm for it, and we can join our hands together. Thank you.
Thank you so much, Dr. Fahmida. Thank you, Dr. Mona. Thank you, Dr. Salim Raihan. And of course, thanks to the participants. Now, for the last more than 1.5 hours, we have been talking about many things, and I actually don't dare to summarize all of these things because I was taking notes. And we have talked about so many things, like we have talked about short-term consequences of COVID, long-term consequences of COVID. We have talked about issues like government strategies, different mechanism to deal with the COVID response. We also have been talking about like how we can deal with the not only the post-COVID challenges, but also the pre-COVID issues, which we are still living with these pre-COVID issues as well. So I would like to highlight few points or pick few points and spend the next 2 minutes maybe to highlight some of the issues. So one is the issue that has been talked about by Dr. Fahmida, that is the issue of data. That is extremely crucial because sometimes we don't have gender segregated data. For example, like Dr. Salim Raihan has intensively worked on intra-household poverty dynamics, I think 15 years back. So that, I think that was the only data set that that tried to look at the intra-household dynamics and intra-household nutritional aspects. So, but we don't have this intra-household data. There are also some other aspects like climate refugees or issues related to some of the entrepreneurs or informal sector job. We don't have the gender segregated data in these issues. So this is very important. In order to have evidence-based policies, we must have data on board and we must have regular data. Secondly, the issue when we are talking about some policies, we must highlight or acknowledge one fact that we have a gender budgeting scheme in Bangladesh, and I think in other parts of South Asia, the gender budgeting exercise is also being carried out. And the fact remains that in the gender budgeting exercise, we are often think about the issues related to in terms of allocation, but it is extremely crucial that the gender budgeting has to be done while keeping the SDG goals in mind and having the gender equality objective in mind. And in this regard, it is extremely important to have a proper monitoring and evaluation, ministry-wise monitoring and evaluation of the gender-centric allocation of the budget, so that the resource allocation really helps to attain the objectives that we are planning to attain. Third point that I would like to add is like we have talked quite a lot about the issues related to different problems that women are facing. That was also prevalent pre-COVID time as well, like the issue of the gender-based violence. So when we are talking about the gender-based violence, we have to keep two things in mind. One thing is like the direct effect or improvement of the law and order, or making the laws very strict and very much implementable. And we must implement the laws, and that is extremely, extremely crucial for women empowerment. Second issue is like it is not only the laws, we need to change the mindset of the people. And in order to change the mindset of the people, there can be role of different institutions. When I'm talking about the institution, we must keep in mind the institutions also include institutions like educational institutions like maybe the media. So they can play a very important role in order to highlight women's position in the society and to reduce the gender gap that is prevailing. Fourthly, I would like to just add one thing and echo the point that both Dr. Fahmida and Dr. Shrestha has pointed out. So one issue is the future challenges and the prevailing challenges the women are facing in terms of the skill. For example, like because of the increased automation, the ready-made garment sector, which has been considered as one of the hub of the main center where a woman has been concentrated in the SEDU formal sector, I would say. So if we think about that, then we see that the representation of women has reduced drastically. It's like maybe 60 to 65%, when the sector previously used to represent like used to have 85% of women. So that means like automation, and that there are future challenges of fourth industrial revolution. That is something which is very crucial, and skill development, upskilling and reskilling of women, these are very important. And Dr. Mona has highlighted the issue repeatedly, and I think it's extremely crucial that the challenges that the women entrepreneurs are facing. So that's why it is important for the female entrepreneurs, there are different arrangement, different incentive packages, different type of incentives, because there can be incentives in the form of separate incentive packages. There can be incentives in the form of the budgetary allocation. But it is extremely important that the constraints and the challenges that women are facing during this COVID-19, that has been properly taken care of. Finally, I would like to conclude that when we are talking about any issues, which and if you want to highlight any issue or look at any issue from a gender lens, we must keep one point in mind, that while we can quantify or we can analyze different issues like the job loss, labor market outcome, the digital divide, gender-based digital divide, the loss in terms of the earnings or loss in terms of the education, there are many hidden costs of COVID, and that is more heavily borne by the woman. The cost when we are talking about in terms of the nutrition of the children, when we are talking about like the dropout of women and the issues related and the challenges related to the skill formation, these things should be highlighted, and these things should be brought into the policy agenda. And when we are talking about the policy agenda,